Hello and welcome to day 3 of our Palliative Care Nurses Australia conference. My name is Claudia Verdon and I am the Secretary for PCNA, a palliative care nurse and now a researcher working at the Queensland University of Technology. As we have each day of our conference, today we start with an acknowledgement of country from Nicole Hewlett. Nicole is a proud Palawa woman that currently works as the National Manager of the Indigenous Program of Experience in the Palliative Approach, or iPEPA. Nicole is passionate about supporting and building the capacity of both the non-Indigenous and Indigenous workforce to deliver healing-informed, trauma-aware and strengths-based care to Aboriginal and Torres Strait Islander peoples. She is driven to ensure that all communities receive equitable access to knowledge, resources and care that are of genuine benefit and delivered in a way that dignifies and respects our sovereign and diverse Aboriginal and Torres Strait Islander peoples. I will now hand you over to Nicole for her acknowledgement of country.
Ya Palajina. Hello and welcome. My name is Nicole Hewlett and I'm a proud Palawa woman from Lutruwita, Tasmania. And today and every day, may we recognise that we stand in footsteps of millennia old. May we always acknowledge the traditional custodians whose cultures and customs have nurtured and continue to nurture this land since men and women awoke from the Great Dream. We honour the presence of these ancestors who reside in the imagination of this land and whose irrepressible spirituality flows through all creation. Today I am on the ancestral lands and waters of the Turrbal and the Yagara peoples of Meanjin and Brisbane, and I pay my deepest respect to elders past, present and emerging of this beautiful country and all the lands and the waters that you are on today. And I extend this respect to all the Aboriginal and Torres Strait Islander peoples listening. We are all on Indigenous country, always was, always will be, and our sovereignty was never ceded. I want to thank you all for the opportunity to present to you today and tell you a bit about the Indigenous Program of Experience in the Palliative Approach, or iPEPA. Now, iPEPA, while we are funded by the Department of Health, our strength, is that we're a program for our community by our community. We are governed by Aboriginal and Torres Strait Islander peoples, and the content that informs our educating health professionals like yourselves is written by and facilitated by Aboriginal and Torres Strait Islander peoples. And that, that ensures that the program has only our voice, whether we're at a grassroots level or a strategic advocacy level. That's the only way we understand of how we can achieve our dream at iPEPA. And that dream is that all Aboriginal and Torres Strait Islander peoples will have equitable access to palliative care knowledge, resources and services so that we can pass with dignity, sovereignty and respect. We are really passionate about working with workforces like yourselves, the non-Indigenous peoples and stakeholders, because we have this intrinsic knowledge that it takes all of us working in solidarity together to achieve this dream and really break down those systemic barriers to accessing healthcare. And many of those barriers for our community, what sits behind them is a story, and it's a story that's often not told. It's a violent story of how the West invaded this country and broke our trust, and how current attitudes and treatments and the environments keep that trust broken. But I truly believe that each and every one of you listening today can make a difference for our people in rebuilding that trust and bringing healing to this country. But it does require, you to undertake a confronting and uncomfortable journey and to transform yourself and your ways of knowing, being and doing so that our people can have that equitable, safe and culturally responsive access to health. Just as, the trees and plants and animals provide all the ingredients to make the ecosystem of life function, harmoniously, so too, to each and every one of you add your own ingredients to create the balance, harmony and healing. And only you can bring your own ingredients. You can take, this journey with iPEPA or many of the other awesome programs that are out there, as you've heard from the other speakers. We offer placements where you can attend a specialist palliative care service for 2 to 4 days and observe and learn, what providing culturally responsive and holistic palliative care looks like in a real world practice. We also have reverse PEPAs, where we come to your service and support the cultural responsiveness across the entire service, and that's often contextualised to your setting and your environment there, as well as the resources that are available to you. And of course, we also have culturally responsive palliative care workshops, which are always an excellent place to start. And these workshops embed, Aboriginal and Torres Strait Islander ways of knowing, being, and doing in our learning approaches. And what do I mean by that? So our iPEPA workshops really focus on finding what we call the Dharma. Like many of our communities, water is a symbol of knowledge in the Yolngu philosophy. And the theory of Dharma is where streams of knowledge combine and lead to deeper understanding and truth. Now, our Yolngu brothers and sisters have drawn on that metaphor for how Aboriginal knowledge, which is represented by fresh water, and Western knowledge, which is represented by the sea or salt water, mix with each other to form a foam. And that foam is seen as a creation of new knowledge. And it's generated from the interaction, the collaboration of Aboriginal and Western knowledges. But, for this new foam to form, there has to be a balance where the two streams meet. If not, as you can imagine, one will be stronger and harm the other. So in our workshops, you bring your knowledge of your role and your service, and we bring our cultural and palliative care knowledge, and we work together to find how we can find the Dharma where we've got this new knowledge, where the two worlds or the two streams meet and can benefit each other. We also have a lot of yarning in our workshops, which is a two-way and a very equal space where we come together and exchange information with a very raw, honest and truthful, exchange, so that we can find a pathway where we can walk alongside each other in this space. Really meaningful change and shifts can happen, but you have to be open and listen deeply for that change to occur, which takes us to the third component of our iPEPA learning approach, which is the DD. And the DD is from Auntie Miriam Rose from Daly River in the Northern Territory. And it's about a deep, still awareness and listening. We have so much noise in our minds and attached to thoughts in a million different ways, whether that be consciously or unconsciously. And of course, when we do that, it means that there's no space for truly listening and connecting to your own spirit or self, let alone the capacity to truly connect, listen to someone else's and therefore understand. But this is what we offer in our workshops, and we try to find the Dharma using Dididi and yarning in this way to find that new foam and to bring everyone together. And if you are not already, you can also be part of this dream to create access for our people. And there are many pathways in which you can do that, whether it's iPEPA, Gwandalin, Katsanam, iHeart, just to name a few. And we all extend, this heartfelt invitation to walk with us and find that Dharma in palliative care. But to generally take this walk, it will require your willingness to undertake that transformative journey I mentioned, and that will involve an openness to listening, to learning, evolving, and most importantly, surrendering your own ways of knowing, being, and doing, as you've already heard from Kat and Cheryl, and you're about to hear something similar from Claudia. But when you have the ultimate privilege of connecting with an Aboriginal and or Torres Strait Islander person, I encourage you to give the gift of your time and spirit, regardless of what the environment is, whether it's clinical, work-related, or social. It can be scary to get out of your professional comfort zone or stand up against the system for what in your spirit, is right. But I promise you, every time you do, you will learn something deep, something that will, move your spirit or will change your heart in a really special way. But of course, you need to be open to that learning and brave, to walk with us. And I know, deep within my heart that each and every one of you have that limitless potential. So I invite you. Naranina to you. Thank you.
Thank you so much to Nicole for that acknowledgement today and for your great insights in how we can work towards truly enabling equitable access to safe and culturally responsive care for Aboriginal and Torres Strait Islanders. I find Nick's teaching about the use of Gamma, finding the foam between Aboriginal ways of knowing and Western ways of knowing through seeking balance and walking together, so powerful. And to achieve this through deep listening and yarning provides clear guidance for us all to engage with this journey. And a journey it is for all of us, given our Australian history. I'm a non-Aboriginal woman, born in leafy North Shore, Sydney, on Gadigal country. And as many have said over the years, I was blessed with a somewhat princess-like existence for my childhood. That being said, I have always had a deep passion within me for equity and justice, and I think that is often close and core to many of us working in nursing. I have now worked in palliative care in various roles for over 25 years, and throughout that time I have met and worked with many Aboriginal people, patients, families, colleagues and friends. However, it's only over the past 15 years or so that I have started to deeply listen, learn and face the uncomfortable moments Nicole has just spoken of, and there have been many. I had to understand my reality, my white privilege, and how I could work hard to not only find the foam in my palliative care work, but hold that foam gently. In my early years, I can recall many times where I know I didn't get it right, because my understanding of the truth of our past was shallow. I therefore didn't understand the layers of grief, hurt, anger, mistrust, and transgenerational trauma. So although I knew I had the best of intentions and was always fiercely patient and family-centred, I was still thinking through my lens, my ways of knowing, being and doing, and that doesn't achieve the foam we are seeking. And I've been so lucky to have been given time and the opportunity to listen and learn deeply from many Aboriginal leaders who I've met through either healthcare circles, academic circles, and or within communities where I have worked clinically. Some of those conversations have been tough. I have made mistakes and I have shed many tears, but the learning for me every step of the way has been profound. So today, Nick and I decided to share this open session in the spirit of walking together to learn and find the balance that will enable better access to optimal care for Aboriginal and Torres Strait Islanders. We have spoken of a story that is a true clinical encounter of mine from a number of years ago, but sadly I hear this continues today. I share this story not because I dealt with it perfectly, but I share this as it was hard. It was scary for me to oppose a senior clinical colleague, so I can only imagine how scary it was for the patient, and it demanded me to be brave and to break down system and access barriers to ensure good care. So my story is about a young man. He was 32 with advanced colorectal cancer. I was working as a cancer care coordinator at the time and had only been in this new role for 4 months. I met this patient within the first week of my new role. He had attended the outpatient oncology clinic for his chemotherapy. He was quiet and a little hard to engage. However, I sat next to his chemo chair to introduce myself and asked where he had travelled from for his chemo. We didn't really talk about his illness at all, but throughout our conversation, he did talk a lot about his 12-year-old daughter, who was deeply important for him. We finished the conversation with me introducing my role, and I talked about some of the ways I may be helpful for him. The next time I saw him, he came into the outpatient clinic to see the oncologist for a regular checkup. He looked less well and he looked frightened. He didn't want to sit in the waiting area. He just looked agitated and very unwell. I said hello and asked if he was okay. Again, he was very quiet and withdrawn and said he wanted to go outside the centre. We walked outside together and he said he had bad pain and pointed to his right flank area. It was different to the rectal discomfort he often had, and he said it was terrible. It made it very hard for him to make the 3-hour car journey to the outpatient clinic. He let me palpate the area and it was tender to touch. The pain started about a week ago and was becoming worse each day. He looked very frightened and asked if I could help. I explained we could definitely help. We needed to assess him carefully to understand what was causing his pain and then work out the best treatment for him. I explained our oncologist was on site and so it was great he'd come today. We would enable a full medical review and then make a plan. I popped in to see the oncologist to explain what the patient had told me and my concerns about his new pain. The door was open to the office and the patient was sitting outside. I don't know whether he heard what happened next, but the oncologist said to me to tell him to drink some cranberry juice and go home. There was no point offering him anything as he was likely to go walk about and not comply with any directions, so there was no point. I remember staring silently at the oncologist at the time as I was actually speechless at his cold, racist and horrible response to a man with progressive cancer, scared, in pain and needing care. I didn't know how to professionally manage this situation with my colleague. I walked out of his room and over to the patient and asked if he would mind if we popped over to the hospital, which was across the road from our clinic, as I wanted to see if we could organise a scan for him. He agreed with this plan and came across to the triage area of the emergency department. I knew some of the medical clinicians who worked in that ED and paged one to talk to. I explained exactly what had happened and that I didn't know what to do, but that this man needed assessment and care, and I needed help to enable this. This senior medical colleague said he was just finishing a procedure and would come to find us in ED. He found me at the ED desk and discussed this man's current pain levels, his recent clinical history and cancer treatment. He agreed to assess him, but only after checking with the oncologist first, as he didn't want to take over medical care without authorisation to do so. That clearly terrified me, as I hadn't told the oncologist I was taking the patient over the road for a second assessment, but I didn't say anything and just let that progress. The two doctors spoke and had a seemingly amicable conversation, so I thought maybe it was all okay. Then the hospital doctor examined the patient and agreed he had a likely ureteric obstruction from progressive cancer. He ordered an ultrasound and set of bloods, which confirmed this, his need for an urgent stent, and the fact that he was actually already in acute renal failure. He was admitted to hospital for those treatments and recovered well from that acute problem, despite a poor prognosis from his progressive cancer. I returned to the outpatient clinic feeling I had done the right thing by the patient. However, the oncologist was furious. He felt I had undermined him, and it created an ongoing tension between us for our working relationship. So my learning from working with and meeting with this patient centred around two key aspects. Firstly, there is still frank racism in our system, and we have to be alert to it and able to stand up to it. But there are also fierce allies within our system, so we need to think about who they are and go to them when they're needed. That physician in the ED was my ally. He listened, he opened doors, he was compassionate and highly skilled. If I didn't lean on this physician, this ally, that Aboriginal man would have been sent home and died in acute renal failure. And secondly, that this patient was deeply fearful of every encounter he had with us. I can still see the fear in his eyes. This was not just fear of his cancer, this was a deeper fear of having to face cancer within a system he was so fearful within. We need to do better at somehow decreasing this fear for all we work with. Sorry. So Nick told us to think about the ingredient we bring, to think about facing that which is uncomfortable, to be brave, to stand up, to listen, and to embrace this transformative journey. So I ask you to think about times where you may have seen racism, whether it be overt or not so obvious. What did you feel able to do? What might you do next time, and who are your allies to enable access to optimal care for Aboriginal people? Sorry, I always get emotional. So now to our amazing plenary that's coming up.